Good afternoon, everyone, and evening time to some of you. My name is Joe Farrell. I am a 15-year survivor of sudden cardiac arrest and vice chair of the Sudden Cardiac Arrest Foundation, and one of the co-chairs with Alex Pursuto, who's on the call on this webinar also, and Mary Newman, the CEO of Sudden Cardiac Arrest Foundation. This webinar is entitled, as you can see on the screen, Reflections of a Sudden Cardiac Arrest Survival, Caring for Other Survivors. I think this webinar is unique for those who have been through or are facing sudden cardiac arrest as a caregiver or indirectly through media reports, and or as a survivor of sudden cardiac arrest. I think our speaker today is very, very well-versed in the research, great experience as a 7-year survivor of sudden cardiac arrest, an emergency room doctor, and Mary is going to finish that intro. Thank you.
Thank you, Joe. We're really honored to have Dr. Josh Lupton speaking today. He has the unique perspective of having survived cardiac arrest when he was in his 3rd year at Johns Hopkins Medical School in 2016, and he went on to study emergency medicine, and he's at the Oregon Health and Science University, and I think he's going to provide us some very insightful thoughts, and then after his presentation, we'll open up for comments.
Perfect. Thank you both very much. I appreciate it. And nice to meet everyone who's on, and I look forward to sort of chatting. Feel free to interrupt throughout if there's questions, and certainly at the end, the goal is to have time for questions and a discussion among everyone. So I'm going to talk about some of the reflections I have being both a cardiac arrest survivor and caring for other cardiac arrest patients and those who survived cardiac arrest. And as Mary noted, I'm up here in Portland at OHSU. So for like a lot of these meetings through CASA and SCAF, our goal isn't to sort of imply that we're providing any direct medical advice to anyone individually. But if anything here sparks an interest, feel free to reach out to your own sort of provider or care team. And this is true both of my talk as well as our discussion. And then I do get money for research into cardiac arrest, though most of my research is related to paramedic and pre-hospital care of patients. So I think in order to talk about how my cardiac arrest has impacted the care I provided patients and what I've taken away from that, I have to kind of take you back and talk about my arrest experience. And so for many of you, if you've gone through a cardiac arrest yourself or your loved ones have, obviously this can be sort of tough to hear or listen to. There's been a lot of stories of cardiac arrest in the media, but I think it's important to sort of understand where I'm coming from. So for me, I'll take you back to Frederick, Maryland, which is about an hour outside of Baltimore. And in 2016 is where I had my cardiac arrest running this half marathon. It was about the 12.5 to 13 mile mark of the race. From my perspective, this is pretty much what I remember. I don't remember anything, right? I woke up a couple of days or remember a couple of days later, and I kind of remember going to the race. At the race, they had to cut off my shirt, which you see here after I collapsed. I was in a shockable rhythm, and they ultimately got me back to a perfusing rhythm, put in a breathing tube, intubated me in the field, brought me to the local hospital. I'll talk a bit about what happened afterwards, but I think the easiest thing to do, if we can get this working, is to share this video.
The life-saving award within the Division of Fire and Rescue Services is given to individuals directly responsible for saving a human life or whose actions, skills, and knowledge in the application of pre-hospital emergency medical care are vital to saving a life. This description couldn't be more accurately describing what transpired on May 8th in 2016 during the Frederick Running Festival. There were 2 nominees today who are directly responsible for the survival of a cardiac arrest victim through their initial swift actions. Their training, fast and early recognition of a person in distress is the reason this patient can be here with us today to help honor his personal heroes.
The incident that we were nominated for was the Frederick Running Festival.
And our duty for the run was to basically just kind of go between the start and finish and keep an eye out for people. And if anyone had an emergency, either close by or that we'd see, we were able to access them pretty quick.
Last year in May of 2016, my wife and I, my wife Catherine, were running in the Frederick Half Marathon.
We were really excited because we love Frederick. It's just a beautiful town that we'd found after living in Baltimore for about a year or two. And the running went really well and we were both feeling good. I think at one point, you know, maybe we got a little bit tired and slowed down a little bit around mile 10, which is pretty natural. And then, you know, but then we kept going and picked up the pace.
And we were near the end to kind of view the finish line. That's the last thing that I remember.
See the finish line right in sight. I was kind of surprised that he slowed down, and I linked my arm, and just right as I did, he fell to the ground, and I you know, helped to soften the blow. In that moment, had no idea what had just happened because I've never been in an emergency situation like that before.
We actually just stopped biking to take a break. We'd been on the bikes for a good bit of time. We'd biked the entire course at that point. And we had just kind of stood up and we heard a noise behind us, turned around and looked, and there was a gentleman laying on the ground who appeared to be having a seizure.
So we rode over quick, and while going there, paramedic Bergen went ahead and requested for a transport unit. And when we got to the guy, he had still been seizing some, and it lasted for probably another 30 seconds while we were there. And we checked him for a pulse and noticed that he had no pulse.
And at that point, we began to do chest compressions. We started CPR, and we were able to deliver a shock with our AED that we had, which in a routine setting, by the time we get to the scene, it's very seldom that we ever get a shock of a rhythm. So the fact that we had one on this gentleman was a pretty good sign.
And after, I believe it was 2 or 3 shocks, he had then had a pulse rhythm back.
This award kind of makes me feel humbled. I never really considered that what we do is heroic. It's kind of just, it's what we do. It's what we signed up to do. It's what we enjoy doing.
Winning the award, I guess, makes me feel good, but we just, I mean, anybody else that was in this field would have did the same thing. We just happened to be at the right place, the right time that day.
If it wasn't for me being so close to the paramedics, just a couple of extra minutes or seconds, I could have had a totally different outcome. You know, I think every member of the team that was involved, and so I know there were paramedics who were on the scene. Obviously, I think those that were involved in giving me CPR right away and defibrillation. There were people helping me breathe, helping me get situated, and then a totally separate and amazing team that helped transport me to the emergency department. So I'm thankful for them. Thankful for, you know, I think pretty much every paramedic that was there that day at the race, because I wouldn't be alive today without the team that helped me. And of course, I thank them, but I know any of the paramedics there would have done the same.
I'm so lucky to be able to work with such a phenomenal group of people. And, you know, that's what makes the difference. It wasn't any one person out there that did anything. It was the whole group. And I'm so proud to be a part of that.
So, not to spoil the end of the story, which is that I survived, which is good. But that gives you a sense of a ceremony about a year later where the paramedics were able to tell the story. Because again, at this point, after my arrest, like I'm not awake, I'm not conscious, I have no idea what's going on. And so my memories of what occurred are really what others have told me since. So I got to the local emergency department and got cooled with cold fluids at the time. I was still unresponsive, and so the the physician team ultimately knew I needed to be admitted to the hospital, and so they flew me by helicopter from Frederick to Baltimore to Johns Hopkins, same place where I'm a medical student. They flew me there to the cardiac ICU. The reality, though, is that at this point, I still was unresponsive. I'd had a cardiac arrest, and so they had to talk to my wife, Catherine, and basically tell her, here's what has happened. And unfortunately, in the majority of cases, patients don't survive. And there's a big chance that if he does survive, he may never be himself again. He may never recover. And then, of course, she had to call my parents, who are on the other side of the country, because I'm 27 years old when this is going on, and tell my parents. And my mom is an emergency department nurse and had been one for 20 years. So she had a sense of the seriousness of it. So she had to get in a plane and fly across country, even though I still hadn't woken up. She didn't know what was going on. And I think what I appreciated later, and this will kind of come up as a theme throughout this, is like, they wouldn't let my wife get on the plane, right, or on the helicopter. So they had to take her, one of the law enforcement officers had to take her back to the Frederick race. Then she had to get in the car and drive by herself an hour back to Baltimore, to the hospital. I still haven't woken up. Keep in mind, we had just ran 12 and a half miles, right? And so, if not for this, we both would have been like, we got to take a shower. Like, we're gross. This is terrible. And instead, she had to come straight back to the hospital. So I went to Hopkins in their cardiac ICU, and fortunately, within a few days, I was starting to be able to remember. I think some of my earliest memories of being in the hospital are having the ICD placed. I was in the hospital for about a week, most of that in the ICU. Got an ICD, which I created this little pictogram here, since it's always been described as like a deck of cards and a bunch of wires, which I'm sure is how many of you with ICDs feel sometimes. And then I had a million tests, all the EKG testing, imaging while I was in the hospital, anything you can think of, you name it. Ultimately, despite being a medical student, being at a great hospital with a very smart team of physicians and caregivers, my diagnosis was idiopathic ventricular fibrillation, which basically means you have ventricular fibrillation, you had a cardiac arrest. Everything we looked at, we can't tell you why. So it's idiopathic, right? And I think that's another important thing to take away, is that, this is something that can be distressing for many folks who have cardiac arrest, particularly early on, when you don't know exactly why. And I'm in the same boat, despite all of these resources, all of the testing I got, ultimately genetic testing, we still don't know why this happened. So I leave the hospital and come home to a mountain of paperwork. Because what you don't realize is that when you have a cardiac arrest and you don't have your wallet because you're running, or in any other instance you wouldn't, you don't have any of your insurance information. And so I came home and I remember distinctly just the stack of bills a week later we already had received from a helicopter ride, which is extremely expensive, and all of the emergency care I had received up for those first couple of days. And we additionally needed to get a referral to see a cardiologist as an outpatient. What I know many of you have gone through before is the difficulty in getting approval to see a specialist. And so they wanted me to get a referral from a primary care. I was young and healthy. My primary doctor was through our student health service. It turns out that person couldn't refer me because they weren't through our insurance. And so it took a few weeks just to be able to get approval to see someone in follow-up. And then ultimately, I was applying for residency positions in emergency medicine. And in talking to all of my advisors, the advice was generally to keep quiet about it. And what I mean by that is to not mention, as I went and interviewed, talked to medical professionals where I want to come here and do residency, they said, don't tell them that this happened to you. You're otherwise a good student. They might be concerned. Do you have brain injury? Are you going to need a heart transplant? Are you going to otherwise not be able to be successful and complete your residency? And so, as you can imagine, being 27 years old, having a cardiac arrest out of nowhere, you still don't know why. You discharge, you get back to your life. It can be pretty difficult. There can be a lot of uncertainty. And I think for me, there was definitely lots of guilt, because it didn't take long for me to realize from talking to the fire crews that just 2 years before my cardiac arrest, someone who was also in their 30s finished the race and had a cardiac arrest in front of paramedics, not too different than my situation. And unfortunately, they died. And so you go through all this sort of survivor guilt feelings. And then for me, I went back in the hospital about 2 weeks later as a medical student. And so I rotated through different emergency departments. And then about 6 months after my cardiac arrest, I rotated back on the same ICU where I was a patient. And what you may not know is these schedules are set 2 years in advance. So I had always been planned to rotate on that ICU. And so I spent a month on the same intensive care unit where I'd had my cardiac arrest care afterwards. And that was certainly a unique experience because you're rounding on patients, many of whom are cardiac arrest patients after a cardiac arrest who have not yet woken up. And that was one of the first experiences where you interact with the care team that you can tell is exacerbated by the reality, which is that the majority of these patients do not do well. And even ones who improve and are able to leave the intensive care unit, a lot of the teams never know how well they do. So I distinctly remember having instances on rounds where there were some of the physicians talking about, well, a lot of these patients do well, but it's so rare to have someone who survives a cardiac arrest and can return to their normal job. And as you can imagine, being able to be like, oh, well, I had a cardiac arrest a few months ago and I'm back to normal, that can really impact not just the way they view cardiac arrest patients going forward, but can make them realize how much of a recovery they can have. So throughout that year, doing CPR on patients, seeing cardiac arrest patients, interviewing for emergency medicine residencies, very unique situation. Ultimately, when match day came, by then I was ready to be able to publicize it. There were some nice videos of us realizing where we were going for match for residency, which was back here in Oregon. And then I was able to write some articles about this experience to sort of convey that patient level uncertainty to the doctors and nurses and caregivers for cardiac arrest patients. So the other part about being a young survivor, and I think the importance of something like our group at CASA, is this realization that you feel alone, right? And so I had a cardiac arrest as someone who is in medicine, going into emergency medicine. I had spent a lot of time doing research in cardiac labs and cardiology. I was fairly informed. I wasn't missing information. But what I was missing was just another human being who was a similar age and had gone through something similar. And so when I got to Oregon, that was when I first started reaching out. And that was when we first started finding other survivors who had gone through a similar story, had gone through a similar experience, and could share that uncertainty, not just for me, but the experience that my wife went through, the experience that my family went through. And so that's what brings me to kind of the reflections now as a cardiac arrest survivor caring for other survivors. So currently, not only do I research cardiac arrest care, I work in one of our highest volume cardiac arrest hospitals in the state of Oregon and probably nationally. We see a very high portion of cardiac arrest patients. And so what that means for me in the emergency department is that I take care of patients when they arrive from the ambulance. In the short term, it's all about the work of treating the patients, trying to get their heart back to a normal rhythm, trying to stabilize them so that they can be, admitted alive to the hospital. So we have time to see, why did this happen? What's going on? But it doesn't take long before I realize, now that the patient's stabilized, I've got to call family. I've got to reach out to someone else. I've got to talk to them about this. Because for every cardiac arrest patient, the important thing to realize is that we all have family, we have co-survivors, we have bystanders who maybe did CPR, and there's so much uncertainty on how the patient's going to recover, if they recover at all, and the reality is it takes time. And so I think the thing that I realized the most as a physician and someone who regularly cares for cardiac arrest patients as a survivor is that some of the most difficult emotional damage of a cardiac arrest, the emotional trauma, is not felt by the survivor themselves or the cardiac arrest patient, but it's by their family members. It's my wife who had to be told that I probably wouldn't wake up. It's my mother who had to hear the same thing until she landed from a plane to hear that I had started moving around and following, some commands, and there was some hope. And so that's some of the most difficult conversations I have are with those family members. And obviously, of course, the hope is patients will wake up and go home with their families. But I think the biggest take home from my work treating patients that have cardiac arrest is that the reality is this is emotionally hardest on the co-survivors and the family members. And that doesn't just hold true for those that are, like my wife there during the cardiac arrest, but it's true for bystanders who provide care. It's true even for caregivers. If you weren't there as a family member during the arrest, but you're caring for them afterwards, there are lots of different trauma that can be experienced by those providing care. These are some slides that I've given to our emergency medicine resident, our physician trainees, but it holds true for caregivers across the board. And the reality is traumatic events can lead to acute stress symptoms, and the spectrum can go to different disorders, longer lasting, and then of course things like post-traumatic stress disorder that many have heard of. But the reality is there's so many different events that can cause this trauma. For us in healthcare, it can be, death of young children, patients that resemble family members. The instance of your family member having a cardiac arrest, that alone certainly can do it. But whatever it is, the exposure can be, obviously the survivor's experience in the event. It could be because you witnessed it in person and it's not even someone you know. Or it could be like my mother, where it's, learning of something from a close family member or friends. Or for healthcare workers, like the residents I work with, repeated sort of firsthand exposure. But I think it's important for us as healthcare providers to know, it's important for co-survivors to know, and it's important for survivors to realize, because as you work on your recovery, your co-survivor, your family, they're also going to be having issues with some of these intrusive thoughts, avoidance, negative mood, reactivity issues that can come after these stressful events, and reasons to kind of seek out and get help if you need. Because it's important for us in healthcare, because we know that, this emotional trauma can cause anxiety, depression, negative coping strategies, and for us, burnouts, worse performance, for physicians, and then unfortunately for a rare few, suicidal thoughts, right? And so I think it's really important to realize as a survivor who cares for other survivors, how important it is to make sure that the co-survivors get help and support throughout the process. So I want to leave time to discuss and not talk too long. So I think the biggest thing as I reflect on my cardiac arrest and caring for survivors thereafter is that the first thing I think everyone should realize is that the cause of cardiac arrest is rarely known right away. Sometimes it's never identified, and this can be frustrating for both the survivors, for those that ultimately go home, and for family in the short term. And then the last is that the trauma of an arrest can really be impacting not just the survivor, but the caregivers as well, whether that's bystanders, families, healthcare providers. And that's it for my prepared slides. I am more than happy to take any questions now, or we can chat if anyone wants to come off mute or put it in the chat.
Josh, this was wonderful. Thank you so much for speaking with us today. As a psychologist, I wonder what it must have been like for you so soon after your event to already begin rotating and then ultimately, staying in emergency medicine and almost I don't want to say you're reliving it, but at least seeing the people that were in your same shoes, what was it like then, and how has it become any easier now?
Yeah, I think that's a great question. For sure, it's easier to answer your second part now. And it was definitely difficult initially. And so before my cardiac arrest, I could be involved in trauma patients or cardiac arrest patients or very ill patients. As a medical student, I had done CPR a lot on patients and seen several patients pass away. for without a doubt, for the first several months after, if not year, those what we call like resuscitation scenarios were much harder to be a part of. I think now I've gone to the other extreme where I take an extreme amount of pride to be involved in those scenarios. In part, it's because of, I think, the ability or appreciation for not just doing good clinical care for the patient, but caring for the family members that are there and making the calls and those sorts of interactions. So I think in some ways it's taking kind of that negative experience, and whether it's from repeated exposure or just kind of coming to peace with the reality that, you know, this is my chance to make this terrible scenario the best version of this terrible scenario for this patient and their family that I can.
Thank you. So inspiring and admirable.
I'm going to hop in. Hi, Josh. My name's Rebecca Scott. I'm a cardiac arrest survivor. I experienced my sudden cardiac arrest at age 45, so not quite as young as you, but young enough that I was well below the average age on the cardiac ICU when I came through and regained consciousness. I like to joke, I'm not a doctor. I play one on TV. Everyone in my family is in medicine, basically, other than myself. So I tend to feel like I have a pretty good head on my shoulders when it comes to understanding and parsing through medical issues. But one of the things that really struck me and has stuck with me is just that there is so little that's done for cardiac arrest survivors who live to discharge. I have to think that's because there's so few of us, but I was discharged with no discharge planning, just released after 10 days in an ICU. And I've done a lot of talking. I live in the Boston area in a very strong healthcare community and strong hospitals, and there's just nothing done. And I'm just wondering if you're working or thinking around what that should look like in supporting patients as they do come to consciousness and get discharged from hospital, because I know for myself, I'm pretty close to 100% cognitive functioning at this point, but I wasn't when I was discharged. I had no frame of reference. My event happened 5 months before the world shut down for COVID. And it was only after reading about ICU patients and the cognitive issues that they experience and the whole host of other things that went along with COVID that I started to make my own connections and wonder why survivors of cardiac arrest aren't supported in the same way. I think there's a real room here. And I'm just wondering if you're thinking about that too.
Yeah, I mean, I think we all not only think about it, we talk about it a lot, and our hope is to improve that. You know, after I got back to Oregon, you know, I sort of alluded to like not having other people who had been through my same experience.
Mm-hmm.
So we started to kind of bring in together these folks in Oregon who had, you know, cardiac arrest, and we had folks join from California, Utah, and elsewhere. Now, I mean, in part, that's what this sort of CASA community is trying to do. In a perfect world, would every cardiac arrest survivor before discharge receive sort of a set of, hey, here's what to expect. Here's a community you can reach out to. Here's, you know, a dedicated therapist or psychiatrist or resource you can reach out to? Absolutely. Do I think that some of these problems are not unique to cardiac arrest and are more indicative of our healthcare system? That's probably true too. I think there's probably a lot of ICU level ill patients that could have better follow-up at discharge in general. That being said, I think now that we are hopefully going to continue to get more survivors from cardiac arrest, it's a clear condition that checks all of those boxes, you know, regardless, right? And so there's no perfect answer other than we're trying to work on it. I know a lot of great folks and organizations are more aware and trying to work on it too. And my hope is that in 10 years, you know, we look back and we say, I can't believe we didn't used to do it this way. You know, this is crazy. We were just sending people out of here, you know, and not connecting them to resources. And there was another question to me in the chat similarly about the lack of psychiatrists and therapists. And I think that's true. Like there's not a lot of folks out there, you know, primary care docs as well, right? I mean, there are many caregivers who, for them, they may have 1 or 2 cardiac arrest survivors in their career that are on their panel of patients that they're interacting with, right? And that's the difficult part of it, you know.
Yeah. Power to you to being able to set your foot in the same ICU. I know I've been back and it's a scary thing. So thank you for doing that hard work.
Yeah, I appreciate it. It's yeah, it's just a strange career path, but it's fun and enjoyable to celebrate the wins. And obviously at our hospital, we try to do that a lot more. You know, I think a lot of healthcare providers, they don't know when their cardiac arrest patients survive. And it in some ways creates this self-fulfilling view that maybe they don't all do well. And they may not be well enough when they go home to go back to the emergency department and say thank you or ever able to do that. So, you know, our system probably could do better at highlighting those successes of, you know, collectively saving lives. And then I think everyone will be, you know, more apt to work to their best in the future, if that makes sense. So.
No, absolutely. I live in a small community, so it's Boston, but it's small in some ways because we know so many in the healthcare field. I've bumped into people who know my ICU nurses just being a part of the community. And they're like, oh my goodness, I've heard this story. I can't believe you're alive. And that's when I realized the people who meant all the world to me didn't know that I'm me and how important that is. So connecting that dot is,
Yeah,
I think, incredibly important in allowing the hospital staff to do their best work. Yeah. Thank you.
Somebody else asked a question in the chat, and you can send me questions, you know, and I won't say who asks. If anybody wants to, if you don't want to pipe up and speak, that's fine too. Or come off mute. Somebody asked a question about, like, you know, the anxiety that something might happen again, or you know, since I don't know why. I don't know that there's a perfect way to deal with that, right? I've got an ICD, so like many survivors with an ICD, I personally feel very protected. I didn't talk about it, but my ICD malfunctioned a year ago and I had to get it replaced. And the week period and I haven't been shocked from it, right? Now I've stopped exercising to the same level, but I've been lucky in that sense. But the 1 week period where I knew my ICD wasn't working, but I had to wait to get it replaced, those were some anxious days, right? Because you don't know, you know, and you don't realize that you have this sort of security blanket with you. But we've got kids that I've had since my cardiac arrest, and I've got another round of testing. You know, we don't know what happened to me, so we couldn't be 100% certain. There's some reassuring parts. No one else in my family's had it happen. You know, there's no clear genetic link. But yeah, the reality is, there's that uncertainty there. In some ways, I deal with it probably because part of my job also involves taking care of people that have terrible, unlucky, traumatic events and spontaneous, you know, this or that, or you know, life is a dangerous place in certain senses of the word. Cardiac arrest being one of the worst, you know, unlucky things that can happen to someone. But we also could, you know, I don't want to live in too much fear, I guess, if that makes sense too. And so all of that kind of comes together to facing it and moving on. And in some ways, facing it probably helps move on, you know.
Hi, Josh. May I jump in?
Please.
Hi, I don't know if you remember me. My name's Russ Grindle. We talked with the Oregon group when you were involved with that. I guess it's still ongoing. But when I got out of the hospital, it was 7 years ago. I got out and I was feeling a sense of celebration. I hadn't really experienced what went on. And it took me a number of years before I realized what it had done to the people around me. one thing that struck me when I was participating with that Oregon group was how young so many of those people were. I was in my mid 60s when it happened to me. I'm 74 now. But 3 years ago, I started having trouble again. I got an ICD with my first incident. I had it replaced at OHSU 3 years ago, and I've been doing really well since then. But since then, my wife has suffered a heart attack. And so now the conversations around that have really brought me around to understanding just how much it affected her. And I feel like I did get some help there, especially at OHSU. I was referred to a psychologist who was working with the EPs at that time, who was specializing in cardiac patients. And that helped me quite a bit. I followed that up. That was short term. So I followed it up on my own with a different therapist who really helped me come to terms with what had happened. My age is part of it too. And I remember us saying in that a couple of chats that I attended that we were all the lucky ones because we were in a position where someone was there. And, but I didn't really understand for a long time how heavily that had impacted, particularly my wife and daughters. And it seems like a lot of other family members aren't really able to approach it very well. Now, my family's not in healthcare professions, but we've been through these kind of events before. And I remember one of my nephews saying after I got out, his experience was, you went in for that reason, you don't come out. And, it just was a lot of impact on people. And I wish that I had understood sooner what that impact was. It just wasn't any preparation for thinking about the people around me. It's just, how do I get back on my feet? I mean, it was last day of summer school. I didn't show up for work. I was back at the beginning of the next school year teaching with my arm in a sling to protect my ICD, but I was back, and that's how I was looking at it. I was just ecstatic that I'd gotten past this thing. And then I got to a point where I'm wondering, why did they stick this thing in my chest? It's like 4 years, nothing's happened. Do I really need that? Can I take it out? And then I started having rhythmic issues, which seem to be pretty resolved right now. The care I got from the EPs there really seems to have got me back into a place of balance. And I have a pretty good life right now. But I really do wish that I could have done more in that time to support my family.
You had your hands full just getting well, honey. That's all we wanted from you at that time, is for you to get well.
Yeah, and I don't certainly I hope nothing comes off that there's nothing from the survivor's perspective that they usually have to focus on other than getting well. I think it's in like the stages of recovery. I think, at some point there's a stage where you're able to realize the impact that their rest has on those around, and for me, I was like, once I'm seeing the spouse of a cardiac arrest patient in my emergency department that I'm taking care of, and that's years later, right? So eventually you get there, and I think that's the point. Honestly, the best case scenario would be that everybody involved gets help in the support that they need. And as from our groups, that was always the focus. Yeah,
that's what I appreciate about organizations like CASA. My wife, since her event, she's done pretty well, and she's following along with CASA too, and she does a lot of comments in there, and she's a better writer than I am, so I appreciate what she gets, and having that added perspective is just something I think is very helpful, partly because it takes the focus off of what happened to me. I'm dealing with that. I'm doing what I can. I'm 74 too. It's all of that is part of my reality. But I really felt like, you know, I started recognizing it. I wish that I had recognized it a lot sooner. That's all. That's the part of what you were talking about that resonated with me. So anyway, but I'll let somebody else have a shot here.
I appreciate you sharing that.
Hi, this is Cindy B. I've been sending you these messages through the chat screen. I just got another question for you. Are you seeing more and more younger people experiencing sudden cardiac arrest than those that made up the statistics in the past? I mean, statistically, sudden cardiac arrest is saying people 50 plus. All right, and more people are showing up in their teens, their 20s, their 30s with sudden cardiac arrest. Has that been your experience also?
Yeah, I mean, I would say not necessarily, but I mean, my experience is just my experience. Like it's. I think if I wasn't a cardiac arrest survivor, I would have this sense from the news because not inappropriately they're covering kind of these major events. It would feel that way. But the reality is, as Russell was alluding to, like because I'm young and a survivor, I connected to 3 or 4 other young survivors. You know, so we would have these meetups where, you know, I'm talking 2019, you know, 3 or 4 years ago, where on this chat there's 5 people under the age of 40 that have had a cardiac arrest for no reason. You know what I mean? Yeah. So and then clinically, like it's really tough to say. I certainly don't. There's nothing that is clearly predominant, other than our region in Portland has struggled some with substance use related arrests and things as others have, which have their own complications. But the reality is, like, my hope is that more people survive cardiac arrest. So across all demographics, the hope would be everyone thinks more people are having a cardiac arrest because more cardiac arrest survivors are surviving and talking and being out there, right? And whether that just means that when you survive, you know, it's not just an obituary and then no one knows what happened, but instead it's a story, and then they talk and they tell other people, and then there's some sharing and connection involved, right? And that really makes it seem like people are alive. I mean, the reality is, if, you know, DeMar Hamlin in the NFL, had he passed away, we probably wouldn't have talked about cardiac arrest nearly as much as since he survived, you know, and he's been out there as a force. So I think all of that's positive. From a research perspective, it's not what I specifically focus on, which is like the incidents, but those that do haven't raised any red flags to a change, other than, again, maybe more people are surviving and being more vocal, which is a good problem to have. So
Thank you.
yeah, of course.
Can I jump in, Josh, Joe, Carol?
Yeah, man, go for it.
Hey, great talk. Some great questions here. I just wanted to kind of follow up on one of the chats that I think Joe Fisher, I hope you don't mind me mentioning your name, Joe, but he wanted to know if there's any stats available regarding as to how many not only survive but return to work. And I think it's a great question. I just quickly share my story. I'm a 15-year survivor, and I wanted to go back to work right away in my physical therapy practice, like within 3 weeks. But my EP guy said, no, you need to take a couple months off. You got to relax, recover, get your mind together. So I was really fortunate. But I tell you, one thing that knocked my socks off the first day I was back in practice, I was treating an EMT. And in my interview, he had a back problem, and he said, gee, I heard you had a cardiac arrest. You know, not many of you live. I go, yeah, I'm very aware of the stats. He goes, you know, those, do you have an ICD? And I go, oh, yeah. He goes, are you afraid of it? I go, not anymore. First month I was. And he goes, well, you know, they malfunction. What a slap. I felt like I got hit with a baseball bat right between my eyes. I just wanted to share that, but I don't know of any stats about survivors returning to work, to their original work. But I think one thing I've noticed over the years of survival is that sometimes people treat survivors, say like those of us that have very good cognitive function and return to work, like with kid gloves. And I was just wondering, Josh, if you felt that way when you went back, not only to medical school as a third year, but when you got working, in ERs, we handled differently.
Yeah, so I don't mind telling people, obviously, that I had a cardiac arrest, but I generally don't if it doesn't come up,
Mhm.
right? And so like I've had plenty of instances where I interact with folks and they don't know. I'll record like within research we publish papers and all this stuff and apply for grants. Like I don't list on any of those that I'm a survivor, and I think most people don't know, or I'll do a podcast related to some research, and then after it's over, I'm like, yeah, well, I'm interested in this because I survived a cardiac arrest. And they're like, why didn't you lead with that? And some of it's probably what you're alluding to, which is that I don't want to, I always joke, like derail the conversation,
Yeah.
because if you're, when I'm a resident and we would be on rounds with a patient who was recovering from cardiac arrest and someone says something, usually it's suggestive that no one recovers cardiac arrest, fully. Then sometimes I'll be like, I did one time have a cardiac arrest though. And I've been working with you for 3 weeks and you don't know, you know what I mean?
Yeah.
But that's motivated more on assuring that the patients I work with get the appropriate care, and people will realize that. To the question of like how many can return to a normal job, the answer is that the best answer is it varies. It depends where you are. It depends on the scenario. Everyone tries to lump everybody together, and if you do that, the answer is pretty low. It's between probably 5 and 10%. Survive with a good enough outcome that the assumption is that they would be able to return to most jobs. I don't think there's a study that perfectly looks, can you go to your exact job that you were in? But the reason I get a little cautious when I think of it as like no one survives is because when I treat patients in the emergency department after cardiac arrest, I don't want the narrative in the hospital to be that no one survives, because then everyone feels less excited about working hard, right? And so I instead focus on more specific scenarios. Like I'm honest with patients and their family members, but that honesty might be, in this scenario, 90% of people don't survive, but in many scenarios, if you survive and come to the hospital, your chances of walking out could be 50-50, right? Like if you've got good CPR and these sorts of things. And those exact numbers really vary depending on the cause. And that's my own personal thought process behind it. But yeah, returning to work is really hard. It also depends when you measure. I know lots of folks who 3 to 6 months out were not back to work, but a year later they were back to their job that they had before. So if you measure it the day they leave the hospital, that's pretty low probably. But if you measure it a year later, it's probably higher. The more important question is, if you ask them a year later, are you happier? Are you glad you're here? Are you, if you can't do your stressful job or whatever you're doing, are you happy with what you're doing? And I don't know what the right or wrong answer is to that.
Thanks, Josh.
Okay, a question. Are there any common misconceptions in the medical community about SCA or SCA survivors? Other than, again, that pessimistic view of medical professionals, sometimes not inappropriately knowing that 90% of folks don't survive cardiac arrest. I think being sure that doesn't mean that the person in front of you is destined to be in that 90% category, I think is the only misconception. And then, as I alluded to, I think there is some fear, not inappropriately, that cardiac arrest survivors are, may not have the potential to sort of fully recover, even if it takes a while. And I think that's another component to it. But otherwise, I don't know. I don't have any common ones that come to mind. So I know we're getting close to the end of the hour, but I welcome for the last few minutes if there's any other questions, discussion, I hope everyone's enjoyed the discussion part of this.
I've got one quick one, Josh, and I've known Josh for a number of years now, so apologies that I haven't asked this in the last 5 years. But in your experience, I'm thinking again about that discharge moment where we all kind of went home clueless, or most of us at least, and that was my experience too. Like, here's your ICD, have fun out there. And I wonder if it would be empowering. I'm trying to put myself sort of back in that bed for someone like you to come in the room and say, like, look, I'm fine. I'm 100% or close to 100% recovered. You can too, or like that feels like an empowering moment in a good way. But I can also see most of the people you're walking around bed to bed might not end up at 100%. So it's like, it sounds like you're opting to maybe not go with that message, but I wonder, like, and this is maybe getting philosophical here, but how do you encourage someone to like push through their healing journey, even if they'll never get to 100? Maybe these are people who only get to 50. I'm one of the lucky few, and I'll spare you the story, but Josh and I, like I said, go back to, I don't remember what year we met, but I had my arrest when I was 33. I'm older than that now, but have made a full recovery. So I would have appreciated that message, but I don't know that that's like a universally applicable moment to say, like, go get them, you know?
John, I mean, it's first off, John. Yeah, John and I go back, and he's the first other like young survivor I met, and obviously meant a lot to my experience of recovery. The answer is it's like an art. I mean, I do not disclose to most cardiac arrest patients' families that I treat that I'm a cardiac arrest survivor. And it's not that I don't think it's important. It's just that at the moment that they're in that level of distress, that may not be the most important thing, right? That being said, hopefully a lot of our critical care faculty at the hospitals I work at know me, and I've offered to all of them to come and talk to any survivor before they go home, right? It doesn't always happen, but on several occasions for sure I've came. And I think mostly it's for kids, like teenagers, which is very rare, but when they have cardiac arrest, like I can tell you, I for sure, when I would go to like, you know, a 14-year-old who had a cardiac arrest and their parents are there and the kid is doing great. Like I know from their trajectory, that kid is going to go back to school. Like it's a safe thing to show up and say, I had a cardiac arrest and I'm a doctor and I'm working. So if what you need to hear is that it's possible to do anything after a cardiac arrest, that answer is true, that it's possible. But that doesn't mean it's possible for everyone, and not everyone is there. But if your question is, does this mean that there's a ceiling or a box and no one has ever gotten outside the box? That answer is no. There's plenty of other physicians who had cardiac arrest. There's plenty of other, insert any professional person or name or whatever. Someone's probably had a cardiac arrest and done that, So John, like, I think if I had met, you and you were talking and doing well, but you were kind of groggy and you're 5 days after an arrest, that's probably an environment where that can be helpful to hear, but also let you know that like, it's not perfect and it's a bumpy road to get there, sort of thing. I don't know if that makes sense or if that's what you were looking for.
Yeah, exactly. I'm just picturing that moment when you could have come to my bedside and I would have felt really empowered. But again, every single person has a different experience from that kind of bed back to the real world. I'm thinking now of the NFL player who's back playing NFL football, less than a year after his cardiac arrest. I'm just like, truly, like you said, any profession, like there is somebody back in that profession.
Yeah, I think I can't work next to an MRI or jackhammers or something. But other than that,
no dams. You can't visit dams.
I didn't know that. I won't do that. Any more questions, comments?
I have one. Administratively, from say like an insurance perspective or whatever, have you experienced roadblocks basically to what would normally be everyday transactions, getting medical insurance, getting a mortgage, getting, do you share your information with these people, or do you not share your information with them, or have you experienced any pushback as a result of having had a sudden cardiac arrest?
Yeah, I mean, I think there's good protections from a workplace perspective. I've never had any issues with that, which is good. But if you're a cardiac arrest patient with an ICD, it's harder to get like life insurance, right? And certain things where there's not a law to prevent that. There's laws against refusing health insurance to folks. So some of that, obviously, I've been fortunate not to deal with, that maybe some older survivors have had to deal with in the past. But yeah, otherwise, unless someone asks me, I don't disclose it. If I'm trying to I don't think for my mortgage I had to say anything. So I probably wouldn't tell them that up front. But that's yeah.
Were you restricted from driving after you had your cardiac arrest?
Yeah, all of that varies by state and medical professionals, so like every state has their own, may or may not have rules related to passing out, cardiac arrest, seizures, all those things. So I don't know. Personally, I didn't have to deal with those restrictions, but maybe it's different. Well, I appreciate everyone listening and the time, and I hope everyone felt like it was useful. And I welcome anyone can contact me on CASA or on my email there, or reach out and come to the other webinars. And I think that's about it. Anything else, Mary or Joe, that you wanted to say?
Just want to thank you, Josh, and also for the great participation for our audience, some great questions, I think, and comments, and the very, very inspiring story, and unique, as someone pointed out in the chat. Want to thank you, and I'm hoping everyone on this webinar will continue to attend the webinars that CASA puts on. We do something every month, and it'll be announced on the events portion of the CASA website, Mighty Mites. So we'll look forward to seeing you all next month, and try to get as many of your friends to join CASA. It's a great community and a great resource. I think one thing we didn't mention, there's one of the resources on the website is about discharge, that Dr. Doshi, who's one of our advisory board members from University of Pittsburgh Medical Center, who also sees many sudden cardiac arrest survivors, as Josh does, has posted a great resource from University of Pittsburgh Medical Center that is probably worth sharing with other survivors. Thank you, Josh.
I would just like to echo Joe's thanks. I think it was very inspiring. Just again, from the comments in the chat, you do have a unique perspective that makes it so interesting. So thank you very much, Josh.
Thanks, everybody. Take care.
Bye, everyone.
So long.